we're going to explore a surprisingly powerful lever for improving your sleep and overall health: the timing and quality of light exposure in the evening. Structured nightly routine. Your body's internal clock or circadian rhythm relies heavily on light cues to regulate hormones like melatonin, prepares your brain and body for restorative sleep. How and when you expose yourself to light in the evening can dramatically influence how deeply and efficiently you sleep. Beyond light you perform before bed, your evening routine can either reinforce or disrupt this natural rhythm. By understanding and applying these principles, you can optimize sleep, day alertness, and enhance your long-term mental and physical performance. Plays a central role in regulating melatonin production, the hormone responsible for signaling your brain that it's time to prepare for sleep. Bright or blue, enriched light in the hours before bed suppresses melatonin release, delaying sleep onset and reducing overall sleep quality. Sensitivity of the human circadian system to light is particularly high in the evening, meaning even moderate indoor lighting from screens, lamps, or overhead lights can impact your ability to fall asleep efficiently. Understanding this relationship allows you to manipulate your environment to encourage natural melatonin production, internal clock with the external light, dark cycle, and enhancing restorative sleep processes, cognitive function, and overall physiological recovery. Blue light, abundant in sunlight, but also emitted by phones, computers, and LED lighting, strongly influences circadian rhythms. In the evening, the blue light inhibits the pineal gland from releasing melatonin, which delays the transition into deep, restorative sleep stages. Durations of screen time can significantly disrupt your sleep cycle, making it harder to fall asleep and reducing overall sleep efficiency. Spectral sensitivity of the circadian system makes blue light uniquely disruptive compared to other wavelengths, highlighting the importance of managing device use and ambient lighting during the hours leading up to bedtime. Reducing blue light exposure in the evening can accelerate sleep onset, improve sleep depth, and strengthen the alignment of your circadian rhythm. Warm lighting in the evening is highly effective for promoting natural melatonin secretion and signaling to the brain that it's time to transition toward rest. Unlike bright or blue enriched light, warm light with lower color temperatures minimally suppresses melatonin, supporting the body's natural circadian rhythm. Grading warm lighting strategies, such as low wattage lamps, candles, or smart bulbs that gradually shift color temperature, creates an environment conducive to relaxation and sleep preparation. The subtle changes in visual input not only support hormonal regulation, but also reduce alertness and stress levels, allowing the nervous system to gradually downregulate activity. Creating a controlled environment in the evening primes the brain for the restorative stages of sleep. Maintaining a consistent sleep-wake schedule is fundamental for aligning the body's internal clock with external day-night cycles. Wake up and go to bed at roughly the same time each day. Your circadian system anticipates these transitions and regulates hormone release, body temperature, and metabolic processes accordingly. Irregular sleep patterns can desynchronize your circadian rhythm, making it more difficult to fall asleep, reducing sleep efficiency, and impairing cognitive performance the following day. The stability of the sleep-wake rhythm also strengthens melatonin production and reinforces other physiological cycles, digestion and immune function. By prioritizing consistent timing for sleep and wakefulness, you create a predictable neural and hormonal environment that supports deeper, restorative sleep and optimal daily functioning. Routines are powerful signals to the brain, marking the transition from wakefulness to sleep and reinforcing the circadian rhythm. Engaging in predictable stimulation activities such as reading, stretching, journaling, or gentle mindfulness practices reduces arousal in the nervous system and prepares both mind and body for rest. Highly stimulating tasks, bright lights, and stress-inducing activities during this time helps prevent delayed sleep onset. The brain interprets these repeated cues as indicators that sleep is imminent, which enhances melatonin release, lowers cortisol, and stabilizes heart rate. Over time, establishing consistently following an evening routine strengthens these neural associations, making it easier to fall asleep naturally, reduce sleep latency. Overall sleep quality. Small environmental and behavioral adjustments can have a profound impact on sleep quality and circadian alignment. Adjusting light exposure by dimming lights or using warm, colored lamps, minimizing noise, maintaining a comfortable temperature, screen exposure all contribute to a sleep-friendly environment. Additionally, behavioral choices such as avoiding heavy meals, caffeine, exercise close to bedtime reduce physiological arousal and allow the nervous system to downregulate more effectively. Even minor changes, devices out of reach, or using blackout curtains can support melatonin production and reinforce the natural sleep-wake cycle. By systematically implementing these small tweaks, create an ecosystem that encourages restorative sleep, improves next-day alertness, and strengthens long-term physical and cognitive health